Alrighty, how are you guys doing today? Well, I am here. I am going to give you, we're going to talk about the new law called the Big Beautiful Bill Act, signed on July 4th, 2025. The law make big changes to Medicare and Medicaid for seniors. Whether you're only on Medicare, you're only on Medicaid, or if you have both, you will feel the effects of it. I'm going to walk you through some changes and explain the effects you and give you some recommendations on what to do next. Okay. Just to give you a little bit of introduction to myself, my name is Cherell Evans. I am owner and founder of Purpose DNA Health in Greenville, South Carolina. I'm your 3-in-1. I do help with your health insurance, life insurance, as well as your Medicare insurance. But I also provide DNA testing to help you find your family, as well as I help you stay healthy with your labs and lab work. Alrighty. So let's keep it moving so I'll be able to give you these details. Alrighty. So, as we stated, the law, Big Beautiful Bill, was signed on July 4th. It changed how Medicare and Medicaid are funded and managed. The people most affected who only have Medicare, those who only have Medicaid, and those who have both. Okay. Also called dual eligible. Let's start with Medicaid first. Okay. Some of the changes for Medicaid. Medicaid is now required to pay, okay, seniors are now required to pay more out-of-pocket care. On top of that, seniors will have to recheck their eligibility every 6 months instead of once a year. Some services now have to pay copays up to $35. And one of the biggest worries is the long-term care facilities may see reduced quality and access because of the funding. So just to give you a quick little breakdown about that, what I just said, instead of us being having to do for Medicaid renewals every year, now you're gonna have to do them every 6 months. I know that's more work. Um, we're gonna get into that in a minute too. The long-term care facilities, nursing homes, and all of those, they are going to see a reduced quality in the hospital nursing homes, a cut of up to $790 billion in over the next 10 years. Okay. That's a huge cut. Thank the Lord it's not going to happen drastically, like instantly, but over the next 10 years, you guys are going to see changes to healthcare, unfortunately. Um, the impact that it has on our seniors, like I stated, you're going to have more out-of-pocket costs. This means higher personal costs when going to the doctors and filling prescriptions, more paperwork, and constant eligibility checks can be very frustrating. Long-term care, like nursing homes, may become harder to get and may not provide the same level of quality as before. These changes hit the most vulnerable people, especially those with low income seniors, the hardest. Some of the key changes. Um, on the Medicare side, there could be some automatic cuts under something called PAYGO, which means if the government spends more in one area, they cut elsewhere. That could reduce Medicare payments up to 4%. Over the next 8 years, though, about 500 billion in Medicare payments may be reduced. Another big change is that the drug price negotiation have weakened too. So that means the prescription drug prices could go up. Seniors who have both Medicare and Medicaid will feel a double impact. This is breaking my heart giving y'all this information right now. So this is just the implementation timeline. Most Medicare changes in phases. These won't all hit at once. Some will begin right away in 2025, like the newly eligible checks and copays for Medicaid. Other changes like Medicare funding cuts will take effect over the next several years. So it's important to stay informed and be prepared for each part of these rollouts. Okay. What this means for seniors. For seniors, this means higher healthcare costs, whether your prescription, nursing home care, or hospital bills, Medicaid benefits may be reduced, and there will be more paperwork and renewals to keep coverage. These changes are especially hard for rural areas, seniors who already have fewer care options. Okay. For low income seniors, you may not have extra money to cover most costs, unfortunately. So, our recommendations here. Our recommendation is to start planning now. Make sure your paperwork is always up to date. Keep track of your renewal dates and talk to your doctors and caregivers talk to your doctors and caregivers. These changes might affect your coverage. Of course, we've discussed that already. If you qualify for extra help programs, apply early. Don't wait. And if you have questions, reach out to someone you trust to guide you through the process. Don't wait until it's an emergency. I am here to definitely help as much as I possibly can. Okay. If you have questions, shoot them to me. I'd be happy to help. To summarize the one big beautiful bill, if you want to call it that, it brings major changes to Medicaid and Medicare starting in 2025 of this year, not next year, this year. Seniors will see higher costs, more paperwork, and possibly reduce access to care. Dual eligibles will be hit the hardest. The best thing you can do is stay informed. Please stay informed. Plan ahead and lean on resources that can help guide you through. You're not alone in this. I'm here to help. Your agents, your doctors, we all are here to help you, okay? So that pretty much concludes what I have to give you guys. I am sorry for such bad presentations, information. I'm here to help you if you need me. My phone number is 1-855-570-7110. You can follow me on Purpose DNA and Health. And I can, on my social media accounts, Purpose DNA and Health, you can follow me. And feel free to inbox me if you got some questions. I might not know everything, but I will find the answer for you. That is my job, my joy to help you anytime, anyway. You guys have a wonderful, wonderful day.